Mr. Chair, there are 11 members present. There is a quorum.
This conversation, this public debate, should have happened years ago, back in 2018, when the people of Michigan first made their voices heard on this issue. The Republican-led legislature chose to adopt these policies, but only with the intent to later gut their contents. We look back now on that action as controversial, but I want to remind folks, because I was there, it was controversial at the time. At the core of this issue is something simple: making sure that Michiganders can take care of themselves without fear of losing their job or fear of having to close a family business. Confidence that their wages will keep pace with the rising cost of living, and confidence that if they're sick, they're not compelled to go into work and get everyone else sick. We will continue the discussion on Senate Bill 15 next week as needed, but then we're going to bring up Senate Bill 8, sponsored by Senator Hertel, next week on the minimum wage.
Mr. Chair, there are 11 yeas, 0 nays. The substitute is adopted.
If I'm the line cook, I know I'm sick. You don't want that person coming into the restaurant, right? Because then they're going to get other people sick, potentially get customers sick, things like that.
Anybody that becomes an employee is covered by the act and would accrue time.
Workers in this country and in the state are facing unprecedented challenges. Michigan families are experiencing the most difficult economic times of their life and are threatened with attacks on Medicaid and the entire social safety net. The harsh reality is that hundreds and thousands of Michigan workers lack even a single earned sick time. Black workers are disproportionately affected, being 60% more likely to not have access to paid leave. This bill would only further the disparities in leave by race and by gender. Every time we create exceptions and loopholes for business size, we are hurting very vulnerable populations. That's also why the private right to action is critical. It's a critical tool that workers have to hold employers accountable for violating the laws.
This is about people, this is about health, and this is about survival. Do I take care of myself, or do I risk infecting my coworkers because missing a day's pay isn't an option? These aren't hypotheticals. These are real decisions that millions of people in this country make every day, and we're failing them. Sickness does not check your voter registration before it knocks you off your feet. It doesn't care if you wear a red tie or a blue tie. Will we be a society that forces people to choose between their health and their ability to pay rent? Or will we do the right thing and ensure that no worker has? I urge this committee to do what is right, not for politics, but for people.
It's really important that we understand that everybody gets sick and everyone should get well. That's primary. But
no one, especially those managing chronic conditions, should have to choose between their health and their financial security. No one should have to decide whether they can afford to rest, take their medicine, or see a doctor. But that's the reality for too many people in Michigan. We need protected paid sick time to maintain both our health and our livelihoods. And small business workers, they deserve that protection too. Working for a small business should not mean giving up the right to take care of yourself and your body. Paid sick leave is not a luxury, it's a necessity. When you cut paid sick time, you are not just cutting hours, you are cutting access to essential medical care for people like me. You must reject changes that weaken paid leave and instead strengthen protections for all workers. Paid sick time is a matter of public health, and public health is my business.
We should have access to earned sick time. And when 41% of Michigan households live paycheck to paycheck, it means people must choose between paying their rent or taking care of themselves or their children.
In my 32 years of childcare, I've seen how the lack of paid sick time creates a devastating domino effect. As a small business owner, I can tell you, providing paid sick time costs far less than dealing with the widespread illness and forced closures. The math is simple. When we don't support paid sick time, we create public health crises in our communities. Every child care provider knows healthy families make healthy communities,